Hi, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I promised myself that I would never give a talk or write an article on ivermectin and its supposed use in cancer treatment. I broke because I can't keep looking at this nonsense that is all over social media. I did write a paper and do a video on the use of fenbendazole, which is used also for worms and possible use for cancer, because I thought it was worthy of a deeper dive and explanation. So before I start talking to you about ivermectin and the facts, you need to understand that there are self-publishing websites. Any fringe doctor can publish their anecdotes, their stories, use fancy medical words, use fancy numbers, and make it seem like it's a clinical trial. Please understand that. It is also patently false that doctors don't want to cure disease or cancer for that matter. It strains credulity to believe that. And then when you say that pharmaceutical companies have no interest in making a certain drug because it's generic or they can't make money, that's just plain stupid. Do you know how many drugs are repurposed and become branded? And if that's the concern about money, they can do that. And there's lots. Did you also know that there are pharmaceutical companies that just deal with generics and they make a ton of money? And obviously that's the case because in the veterinary world, ivermectin is made generically and companies make a ton of money. So on to today's topic. There is currently no evidence, none, zero, zippo, from human clinical trials that ivermectin increases progression-free survival or overall survival in any type of cancer. And believe me, I would want it to work if it did. And frankly, anybody who tells you any different is giving you a line of bullshit. Okay, so most of the available data on ivermectin's anti-cancer effects are from preclinical studies, either in a test tube, on cells, or in animal models, which demonstrate mechanisms such as inhibition of proliferation, induction of apoptosis, and modulation of oncogenic signaling pathways across various cancer types. Sounds great, right? Fancy words. However, none of these findings have translated into robust clinical evidence in humans. A recent review highlights the absence of large-scale randomized clinical trials or conclusive clinical studies showing therapeutic benefits of ivermectin in cancer patients, including improvements, as I said, in progression-free survival or overall survival. Observational studies and case reports are limited and do not reliably show any efficacy data. The only human clinical trial data available is from a phase 1 and phase 2 study, which combined ivermectin with a drug called balstilimab in metastatic triple-negative breast cancer. The trial reported safety and some clinical benefit rate, but did not demonstrate a statistically significant improvement in progression-free survival and overall survival. And the overall survival data was not mature at the time of reporting. The study is still ongoing and no definitive survival benefit has been established whatsoever. So when you say that there are no clinical trials, there have been done plenty of them. The problem is if a phase 1 trial or a phase 2 trial doesn't demonstrate any efficacy, why would somebody continue on and do a phase 3 trial that they know is going to fail? Doesn't make sense. So you need to use logic. Okay, ivermectin does not work as much as we would love it to. It does not. So with that, I hope you learned something today. Thank you for listening. For more information, you can go to my website at www.paladinmds.com. And thank you for listening.